Hi everyone, I'm Dr. Lin of Rehab and Physical Therapy. We have our frequent guest, Stephanie, back again with us. We're going to talk today a little bit about lower extremity nerve flossing. It's more like flossing, gliding. We want the nerves to be able to slide and glide, and that's really important. As you can see, we have an upper extremity nerve flossing video somewhere, and we'll post that eventually. But what we want is we want to be able to, all nerves, they come from the spine and then they're going to come out, and then what we have to do is we want to tension them, and so it's not like a stretch. A lot of people think this is more like a hamstring stretch, but this is an ability to start moving the hamstring and the nerves away from each other, trying to slide and glide or floss. They run through thousands of tunnels on its way from the spine all the way to the toes, and we want to be able to get those things and be able to free up those little adhesions and scar tissue. So this is how we're going to start. All right, Steph. Knees bent is easier. Eventually, you could try it with one leg down, and that's a little bit harder. So that's kind of a way to set things up. But in all intents and purposes, we really want to be able to bring your knees there. It puts your nerves on slack, doesn't put a lot of pressure. We start on your back is always a good place. So what we want to do here is we want to bring your hip to about 90 degrees. So we'll do it on this side, hip to 90 degrees. That's a good place to start. I also have devised something to just monitor. Some people with nerve pain generally have some awareness issues. So we want to stick your hand down towards your lower spine. Anything that's short, a shortened nerve or shortened tensions somewhere else, it's going to tension somewhere. So usually it's the lower back. So those are going to go together. Either anywhere between is going to have tightness either in the lower back or tightness around the leg. So you have to listen to your body. It could happen both together. One could happen, the other may not happen, but whatever occurs first. We like to use a strap, a little stretch strap or a yoga strap, and you can use the other hand. So that holds it at 90 degrees. And then what we want to do here is we want to be able to just go to the point of tension, and it's about right there for her. Anytime you go past it, your nerves don't like it. They become angry nerves. So I know there's that new movie, Angry Birds. There's angry nerves that can happen too. So what happens is then at the point of tension, you create a little bit of what we call dorsiflexion or flex the foot, and then you hold it for 5 seconds. Make sure you check with your healthcare professional. This is the right way for you. I like teaching it very conservatively. There's some aggressive ones out there, and I don't approve of those. So, those things really can make you have numbness or tingling. The things you have to watch for is you want to have numbness. You don't want to have numbness or tingling. You don't want to have increased tightening. So if every repetition you keep going after it gets tighter and tighter, then we run some problems. You're actually overshooting your barriers. So listen to the monitor right here, and also you want to do your hands and check if there's any tension through your legs. Over time, if it's doing well, it goes a little bit further and further. There's less pain, less numbness and tingling, less symptoms overall, and less hypersensitivity. So that's a way to go about it. But make sure you monitor all your lower back as well. Great. And you don't want to overstretch. Overstretching, you can see that your back will dip into the table or into the floor, and that's going to cause more increased tension over the long term. So it might feel good, but imagine this, if you can't go this far, imagine if you're driving a car, then our legs often are a little bit more stretched out than this. You're putting a lot of nerve tension in the car. So those are the things to really think of. And like I said, if you want to make it a little bit harder, a little bit more advanced, once you've got more freedom, you see that she's already gone past it. So that was actually not good. This is where she's supposed to be. So bad Stephanie.
Not right.
Yeah, right here. So that's it. So we'll have a closer look on how you should monitor in the next scene. All right, so this is the monitoring step. You slide your hand. You could either if you can do palm up, it's better. You can feel against the lower spine. If you can't, then just leave it down. You want to press it against your lower back though. And what happens is once you start the nerve flossing, if it dips down and puts pressure, I often can tell, if you go past, you can see what happens. Her back starts going down. And you see something moves right here. If you really look closely, they move together. So that's not good. That's too far. That's gonna hurt. You're overstretching your nerves and going past the barrier, and that's going to be a big issue. So make sure you listen to your body and understand where that should go. And it should be very gentle, but your nerves will then release, and then you'll be able to have a more healthier nerve. All right, so there you have it. That's the lower extremity nerve flossing. It's quite helpful for my patient population. So here's a review of some of the steps that we want to go after. You lie on your back. You either start with your knee bent. If you want to progress it, you make it a little tougher with your knee straight. You bring the affected side, your hip to 90 degrees. You use the same side hand, stick it underneath your lower back so you can monitor. And then you go towards your barrier by extending your knee slowly. You can use a strap. You don't need a strap, but you can. You can extend your knee to the barrier, then you flex your foot. You hold it for about 5 seconds. You don't need to hold it any longer. Make sure you avoid the numbness and tingling and the increased tightness. It should free up if you're doing this correctly. And then what you want to do is you repeat it, for a couple minutes as well. So make sure this is safe for you at home and you've checked it out with your healthcare professional. Do it at your own risk. But like I said, it's a great exercise. We want to free up all those little adhesions in the tunnels. So if you like what we're doing, we're pushing the limits on a lot of these exercises. We're changing the paradigm a little bit. So please subscribe to our channel. We're trying to get out as much information as possible so we can help the world. There's a lot of you from all over the place checking us out. So thank you so much for being our fans. Leave a comment, or if you have any thoughts or ideas, you can email us at rehabandrevivemedia@gmail.com. I'm Dr. Lin, this is Stephanie. We're here at Rehab and Revive Physical Therapy. Remember, we can and we will get better together.
So if you can't lay down to do nerve flossing, here's a little bonus tip to do it while you're sitting at work or at school, or even if you're just hanging out in your room and you're sitting on a chair for some reason, or on your bed. So you want to do the same thing, and you want to monitor the back of your lower back with your hand, and then with the affected leg, you want to do the same thing where you kind of bring it out until you feel tension, and then you want to flex your foot and then hold that for 5 seconds. So it's the same idea, you're just doing this and sitting instead of laying down. That's pretty much it. I'm Stephanie from Rehab and Revive, and I'll see you in the next video. Bye.
This is as far as she goes. Now you hold it for 5 seconds only, okay? And then you do it for about 15 times, but 10 to 15 times. But 5 seconds, hold, and then you come back. Now there's some big points I want you to consider when